Healthcare Global Enterprises, HCG, has become the first hospital in Karnataka to treat cancer patients using the Elekta Unity Mr. bringing one of the world's most advanced radiation therapy technologies to the state. The Elekta Unity Mr. combines a high-field 1.5 Tesla MRI scanner with a linear accelerator, enabling doctors to view tumors in real time and adapt radiation treatment during each session. This allows highly precise targeting of cancer while protecting surrounding healthy tissues. HCG founder and chairman Dr. B.S. Ajjakumar said the technology marks a major step forward in precision cancer care, helping improve treatment outcomes with minimal side effects. Executive Director and CEO Dr. Manish Mattu said the new system will expand access to personalized, adaptive radiation therapy for patients across Karnataka and neighboring regions. Elekta officials said the partnership with HCG will strengthen the adoption of Mr-guided adaptive radiotherapy in India through advanced technology, training, and clinical collaboration. With cancer cases projected to rise sharply in India over the coming years, the introduction of Karnataka's first Elekta Unity Mr. is expected to significantly enhance the quality and precision of cancer treatment in the region.
90 days, we have treated more than 800 new patients. We've done more than 120 major surgeries and received a lot of confidence from our catchment and patients coming here. And we look forward to treating more and more patients from Bangalore, patients traveling to Bangalore from India, of course, internationally to India and to Bangalore for taking treatment with us. Today, during the course of our discussions, we also have our radiation oncologists who will discuss some case studies with you and highlight how MR-Linac, a very unique precision technology in radiation therapy, benefits.
But I know you have a good press meet plan, but I just want to highlight why HCG has partnered with Elekta and set up this state-of-the-art unit, the MR-Linac in Bangalore North. I think the primary reason is, if I look at the 50 years of my practice in oncology, the past, present and future, what you're looking at is truly the future of oncology in precision medicine, where you can treat the tumor without causing any problem to the surrounding normal tissue. That is precision. And this is the extreme form of precision using an MRI guided, where we can localize a tumor and relocalize even intrafractionally. And this unit is really a boon to the Bangalore and surrounding areas, this part of the country. So people who deserve this kind of precision treatment can come and get the treatment with literally no side effects. There are indications for this, but those who qualify will receive treatment, and pretty much the tumor can get the maximum dose, as you heard, with really zero dose to the normal tissue or very minimal. So I'm very happy to be a partner again with Elekta, who have been in forefront of technology in this radiation oncology. And we have worked very hard to bring this unit for the last several years. In fact, at a personal note, I had to go to Stockholm, meet with the board and to work out the methodology under which we brought here. So I think it is
better our own record through these partnerships. And it's not just technology. I think a lot of credit should go to clinicians who take the chance and who are, always passionate. Two of them are here, passionate about bringing the best technology for the benefit of patients, it's on their shoulders, themselves. I mean, the clinicians, the nurses, everybody who's involved in the care journey of patients, we're very fortunate to have them on board and hoping that we will continue to create milestones through such. Is coming down. There is hyperfractionation that can be used. I think the most critical and the most important, and I'm very happy to see that adaptive radiotherapy is now something which should be commonplace, just like robotic surgery and immunotherapy. So very happy that we've kind of solved that puzzle overall, because patients are asking for non-invasive precision solutions now, and earlier we just had immunotherapy and robotic surgery, so to speak. And radiation cycles typically going on for 25-30 days at one point in time wasn't the most convenient option for patients. So very happy that we have this solution now, which will not just make cancer treatment more precise, but less painful as well.
I think the first thing that you should know about an MR Linac is that it is an engineering miracle. An MRI, magnetic resonance imager, creates a big magnetic field. That's how it works to create images. And a linear accelerator, a radiation delivery device, has all sorts of electronic components to it. So being able to come up with a design that combines those two technologies is an engineering miracle. And why is it important? Why did we work literally for 20 years trying to tweak the engineering to make this device a possibility? It's because the body changes. It changes all the time. It changes when we're breathing. Your stomach is expanding, your bowels are moving, your bladder is filling. These changes affect where the tumors are in your body. And historically, we haven't been able to see that. As Dr. H.A. has sort of mentioned, we've generally had to lower the dose or treat large areas because we couldn't see. But now we have integrated an imaging technology of MRI that allows us to see more clearly and in real time. Literally while the beam is on, you can see where the target is. You can see where other structures are. So very, very simply, an MR Linac allows doctors to see what they treat. Previously, we would take a picture and then essentially we would have a blindfold and then we would shoot, right? Now we can see it and we can be very confident. And the implications are that when you can see what you treat, you have greater precision, you can treat more aggressively, so the cure rates go up, you cure more patients, you can treat more safely, so the side effects go down. And because we can be so precise, we can actually be much more convenient. And so instead of having patients come in 20 times, we really envision a large number of patients that may need to only come in 1 time, 2 times. Like that's the world we're heading in. And when we talk about sort of the burden of disease, thinking about the impact that has, saying you only need to come in once and then go home, that has a big impact in addressing that huge burden of disease.
First of all, following what Dr. Ajay mentioned, Dr. Manish mentioned as well, is that for us, treatment is a comprehensive multidisciplinary approach. Coupling, high-end technologies such as MR Linac, along with our clinical experts and the way we personalize treatment for every patient, is having all the disciplines, which is all the modalities, so medical oncology, surgical radiation, oncology, imaging experts, even nurse navigators, nutritionists. So everyone sit together and devise a personalized treatment protocol for the patient. And this is for all our centers. What HCG has is the largest dedicated and integrated oncology network across India. And since you asked about the state, so we have 6 hospitals in Karnataka state. We have 3 daycare cancer centers as well. So we have 9 units already present. And a patient can therefore go and get diagnosed and consulted any of our HCG centers which is closest to them. So, we have 1 in Gulbarga, we have in Shimoga, we have 2 in Hubli, we have 3 in Bangalore. And when they consult the clinician there, a multidisciplinary tumor board is set up there in that center itself. And the patient can then be referred to Hebal for MR Linac treatment if it is advised for the patient. Continuity of care will be maintained, logistically, psychologically, so they can come avail the treatment here and go back to their city, to the native city, and continue the post-radiation treatment consultations and so on in the HCG center, which is closest to.
Well, and actually today is the last treatment he completed. So even today I asked, so he said like no side effects or no signs and symptoms of any side effect. So that is a major advantage we got with this MR Linac treatment. I had worked previously with various technologies, various linear accelerators.
Good afternoon, all. So it's been a very exciting new dimension with respect to MR Linac coming at HCG hospitals. We are proud to also say that we have treated the highest amount of adaptive treatments in India. With MR Linac coming in, we are able to adapt to whatever challenges the cancer poses. So, and with the integration of AI, the buzzword is AI. So now we have AI contributing to creating impact to patients, to also absolutely target the intended area, and in turn, as Dr. Surendra was pointing out, we are able to reduce the side effects to as minimal as possible. So ultimately, we are focusing on precision, highly personalized and customized treatment for our patients. With MR Linac, that accuracy is enhanced because of MR soft tissue delineation and soft tissue visualization, and the exact amount of dose is being delivered, and we know stage 4 cancers. Probably half a decade ago, if you see a patient of stage 4, probably people would have said it's a death sentence. But now, in cancer, that analogy is being challenged. Where in cancer, it's being treated like diabetes and hypertension, where people tend to live longer. Stage 4 is not a death sentence. So we have started treating stage 4 cancers with advanced technology because these people tend to live longer as well. And with genomics, with proteomics coming to the fore, we can exactly evaluate why the patient is having a certain amount of cancer and at what time frame can be targeted either with drugs or with radiation. And that is how we sequenced the lung cancer patient with adrenal metastasis, where we were able to target those lesions with pinpoint accuracy, and it's just a 5-day treatment. So Dr. Surendra is treating the patient for 25 to 30 days. Whereas there's also another capability in the modern era where we can use SRS and SBRT in MR Linac, where we can conclude our treatments within 5 sittings